Typically, sedation is not covered in this fashion by a dental insurance plan. So that usually is not the case.
Okay. And once again, let's go over how that sedation drug is administered. You made it very clear at the top that it's a small pill.
Right.
But you also talked about injections. So let's make sure we fully understand what you were saying.
We still have, just as if you went to an oral surgeon and were sedated with an IV medication, you're going to still require local injections. So you're still going to have to be numb in your mouth for the dental procedure, whether it's a root canal or an extraction or a filling even. So you don't get away from getting the local injections. The beauty of being sedated for the procedure is you don't remember that you got the injections and you don't feel any of that stuff. So
is that part of the fear in the first place for someone thinking, oh, I dread the thought of being numbed?
It's that. Sometimes it's the sound of the drill and stuff like that people just don't like. We hear that every day. And like I said, we've all had bad experiences. At least most of us that don't like going to the dentist have had a bad experience at some time. It's just kind of stuck with us, either as a child or even as an adult. So it can be a whole myriad of different reasons why. But the things that we use in our office, obviously with we use the pill to sedate, but we also have nitrous oxide, and that sometimes accompanies the pill. We sometimes put patients on nitrous oxide during the procedure.
All right. So we talked about that the patient does not feel the pain, but if they were not given the Novocaine, they could feel the pain regardless of being put to sleep. Some of us may have a difficult time understanding that.
Well, you're still being numbed the same fashion that you would if the anesthesia is the same to numb the teeth. So that's going to take place the same way. When you're sedated, if you start becoming unnumb for some reason, you can tell me that. I can tell whether you're feeling pain or not. So it's not like we're going to not notice that and we're going to give you more anesthesia. Okay, but the nice thing about the pill is that you're relaxed. You don't really care that you're getting an injection because you're sleeping. So it's a whole different set of circumstances.
And going back to making sure that you're laying there and you have a chance that the suction is working.
Right.
Because you don't have that option of leaning over and spitting, even though that doesn't happen anymore with the new technology. But your assistant would note that this patient needs to have the saliva suctioned out appropriately without having to say it.
Right. But you can still swallow. You can still talk.
You can.
Yeah. I mean, we typically, I can jostle a patient and have them communicate with me, but they don't know what they're saying. They can tell me things, like, can you hear me? They can hear me.
Okay.
But they don't, it's a very, it's not, they're not unconscious, I guess is the best way to say it.
They're kind of like in the twilight zone.
Exactly.
Kind of like when you're going to sleep or you have that half feeling.
Right.
Okay, I'm just trying to understand how
all this works. Very comfortable way to have dentistry done. I think is the way to best describe it.
Okay, so you said that there are stats showing up to 30% of the population, what is that, in this country, are apprehensive about going to a dentist because of the fear, the anxiety, being reluctant. How many people are you finding in your practice of having this procedure? I'm assuming that not everyone comes to you for sedation.
No.
Am I correct in that assumption?
Precisely. We don't do sedation dentistry every day. In my office, it's maybe 1 or 2 times a week. It depends. Sometimes we don't do a sedation case at all during a week.
So does that fall with your practice and your colleagues' practices, that 30% range, that 20 to 30% range, where you're finding, this is a growing concern. 30%, that's a lot of people out there.
It is, and that's why we're talking about this, because I think there's a lot of people out there that just don't go to the dentist because they're afraid.
Wow. Well, we still have about 10 minutes, and you're welcome to join the conversation at 704-371-8895, and you can send me an email at jpop, that's J-P as in Peter, O-P-P, it's on the screen there, at WTVI.org. If you have any questions, we've all heard about sedation dentistry, and we've never explored the topic here on Healthwise. Well, this is your chance. And we've had some good questions tonight from across the region, and we certainly welcome your question. Now, You said that someone would need to drive you in and drive you home.
Right.
Is that patient also with you during the, is that mate or is that person that's going to be your driver, are they also standing by during the procedure?
Usually not there during the procedure, but they're called, ahead of time to come pick up the patient. And they've already, one of the things we do in our office is they've signed a consent form. The patient obviously has, but then the person that's going to take care of them, we've gone over a whole list of things that they need to be responsible for.
Are they like the power of attorney?
Well, maybe not
sorta?
to that level,
Yeah.
but they definitely, there's probably about 10 things that they've initialed that go down the line of this is what you're responsible for. This person can't go out and drive a car today. They can't walk up and down stairs today. They can't,
You're not going to go out to lunch afterwards.
No, they can't go take care of a small kid that day. There's things that we got to make sure that the person, the caretaker, is understanding before they agree to be the caretaker, because it's a big responsibility. You don't want to let this person go home and take them upstairs in a 2-story house and leave them there and have them fall down the stairs and get hurt.
Right, exactly.
Because they're not right yet. So
yeah.
You got to be. Usually it's a spouse or a loved one in that fashion, a sister.
And, as we get older, we've all had procedures, whether it is a colonoscopy or going in for some type of eye procedure, that we can understand what you're talking about.
Right.
It's just another way of making sure that that person is monitored once they've left the office.
Right.
And during the office visit, let's re-examine how that patient is monitored, if anyone has any question about that whatsoever.
Well, they're well screened. I think that's the main thing I want patients to understand that are listening, is that you're well screened.
And what does that mean?
Well, you have to make sure that they're medically okay for the procedure. Do they not have 3 or 4 different medical issues on board that would possibly keep them from having this procedure done? You don't want to risk their health to fix their teeth.
And we had a caller earlier who had 5 heart attacks.
Right.
And that would be a major red flag, I would think.
For me.
Yeah, for a doctor like you, a dentist. But does that necessarily mean that that person would not be a candidate?
Not necessarily. I just think they probably need to be in a different setting. I think they need to be. This particular patient that you're referring to need to have a lot of teeth removed, and that's probably a good reason to see an oral surgeon and be IV sedated, where you can reverse them quickly. There's other things that you want to be able to do in that circumstance, and with oral sedation, the way we instrument, it's hard to flip it quick. Even though we have a reversal agent, you're still titrating with pills via the oral cavity. They're having to swallow a pill. They don't lose their ability to swallow during this procedure. You were referring to suction and having saliva in your mouth. Obviously, if we're giving them a pill during the procedure, they're able to swallow, and they're able to listen to us, and we can say, hey, Joey, you need to swallow for us now, and we give you another pill.
And I would be able to
And you can swallow.
Okay, let's head up to Statesville. We have Patty with us now. Patty, welcome to Healthwise with Dr. Ed Porter.
Thank you.
Hi, what's your question?
Yes, I have a 10-year-old son, and he was adopted. Well, when he was born and his teeth started dropping, he was born with a lot of, he didn't have any enamel in them. They were brown. Well, the dentist that we've been going to, we've asked about lumineers or something that he could do to them. Well, he fixed the 2 front ones, and they are like a real off-looking tan, almost yellow-looking color.
Okay.
And my son, if he had a clue that he got a shot when he went to the dentist, he would not ever go. But I'm wondering if somebody can fix this in him 10 years old, because our dentist is telling us that he has not finished growing. There's no need to go and put, like
veneers
crowns or lumineers on his teeth.
So are these teeth that are discolored, are they his permanent teeth?
Yes, they are.
Okay, let's hear what Dr. Porter has to say, and stay on the line with us, okay?
Thank you.
Well, Patty, I think that's a great question. Unfortunately, a 10-year-old is probably not the age range that we'd want to sedate in this fashion. So that's a different scenario altogether. I'd probably, if it were my child, I would want to wait until they got older. So I would try to do